Reduction of transmission is low, meaning we are not going to impose harder lockdowns or harder measures. 430,000 active cases nationally. We will have that by the end of April.
This was the grim projection that the health department wants to prevent. It's more than 10 times the average number of currently infected individuals back in January. Hospitals and treatment facilities are now stretched to the limit.
We are choking. We are having full capacities in ERs, in ICUs. So gusto ho nating ma-manage ng maayos to.
As of Saturday, 42 hospitals in Metro Manila are at critical level. 70% of ICU beds are in use, while at least 5 hospitals are at capacity. There are only a total of 42 remaining ICU beds in the provinces within the NCR Plus bubble: Bulacan, Cavite, Laguna, and Rizal. In some hospitals, COVID-19 patients have to wait for about 3 days in the emergency room before getting admitted. Though almost full, the Philippine General Hospital and East Avenue Medical Center have no choice but to accept patients turned down by other hospitals.
Those who are emergently ill and he needs intervention, sometimes we just ask them to come already because kung mamatay naman sa bahay, mahirap din.
Some patients are hopping from around 3 to 4 hospitals before they proceed sa East Avenue Medical Center. Hindi namin kaya na tanggihan pa itong mga pasyente na ito. Wala nang ibang hospital na tatanggap sa kanila.
East Avenue Medical Center is opening a newly renovated emergency room with 30 beds to accommodate more patients.
But considering that we have still patients waiting at the emergency room, pagkabukas namin, hindi malayo na mapuno kagad ito.
Manpower is limited, so they need to pull out nurses and doctors from other departments. They're also expecting 10 nurses and 2 doctors from the provinces. The PGH also needs manpower reinforcement, as the hospital sees 5 to 10 newly infected healthcare workers every day.
We have to close the non-COVID part of the hospital. So many of our non-COVID patients have to go to other hospitals, and we have postponed non-COVID elective procedures.
To hopefully provide relief to health facilities, the health department said military health worker reservists will be deployed in hospitals. More beds will be added in selected hospitals and modular hospitals by April 8. Carolyn Bonquin, CNN Philippines.